Hi, I'm Andrea Merriam. I'm the CEO of PMD Alliance, and so glad, so thankful that you are joining us here today. Our full team is on, and it's a chance for us to talk about how hard we work. We care so deeply, we work so hard, and so much so that sometimes we realize we don't always do a great job of celebrating all that we do and informing all of the different areas of the ecosystem about what we're working on. So, appreciate the architect of today's call, Aaron King, our Director of Development. He's going to be our MC, but this was his brainchild to really tell our story. And Aaron, I'll let you take it away. So, you think you know PMD Alliance? We're going to teach you more. So please, welcome, Erin.
Wow, you said that better than I could, so I'm not even going to bother trying to restate the title of why we're here. So welcome everybody I think I've met quite a few of you here, but for those that I have not met, again, my name is Aaron. I head up the development effort here. But today I'm kind of going to be more of your tour guide, your MC, maybe your flight attendant, but there's not going to be really any food or drink service. Let's cover some of the logistics for today, and then I'll get out of the way and let us really get into the meat of the content. Today's conversation is going to be made available on our YouTube channel tomorrow. That being the case, you may hear me reference our YouTube audience a couple of times today. I just wanted to give everyone a heads up in order to prevent any confusion. Also, many of us, and that includes me, have a habit of speaking just a little too fast. I know that can be frustrating for some of you, so we've done a couple of things to address this here today. First and foremost, closed captioning is available for this event, even live. There's going to be a note popping in the chat over on the side here in Zoom on how to enable closed captioning for today. For our YouTube audience, feel free to just hover over the video. You'll see the closed captioning button in the bottom right-hand corner. You'll be good to go. For those of you here live, you can also watch this on demand tomorrow. We're going to cover a ton of material, probably some stuff that you may want to come back and listen to again, really digest what we're talking about. Take advantage of it being on demand. You can fast forward to the parts you found really interesting, listen to them, watch them again and again. Finally, this event is for you. Please ask questions. The entire PMD Alliance team is here with us today, and they're all monitoring the chat. Any questions that come up, please feel free to drop them out there. I promise you, I pinky swear that somebody from PMD Alliance will answer your question for you. For our YouTube audience, if there are any questions that you have, or for those joining live, if there's any of you who come up with questions after we conclude, send me an email directly. My email address is Aaron, Aaron, at pmdalliance.org. So that's all out of the way. Let's get started with the fun stuff. One of the things we pride ourselves on at PMD Alliance is engaging with all of you and listening to you. A theme that we continue to hear from all of you is a frustration about finding access to quality educated care. We've been investing heavily into addressing this problem, but we haven't really done the best job in communicating. We're working to be better at it. And in the meantime, a big part of today is us kind of pulling the curtain back to show you the work that we're doing that you may not be aware of. This is work that's being done for you, but it also needs to be done with you and alongside of you. We're only going to succeed in doing this together. So I'm super confident that you're going to find this as exciting as we do. With that all out of the way, I would like to introduce, easy to say, Rebecca, our Deputy CEO, and the driving force behind this initiative. She's joined by a few community members that I will allow her to introduce. Rebecca, take it away.
Hello, everyone. I definitely also see faces that I recognize. I'm glad that you all are joining us today. Aaron said something a moment ago where he promised you, he pinky sweared that any question you wanted to ask would be answered in the chat. And I was so tempted to ask Aaron what came first, the chicken or the egg, in hopes that somebody would answer that question. But, So put all the challenging questions in there, throw us for a little bit of a loop, because I'm sure somebody will probably still respond anyway. So I do have with me some three humans that I just absolutely adore. I've had the opportunity to get to know each of them just over the last couple of years in different scenarios. And I know Erin was like, I get to introduce them, but I actually want them to have the opportunity to introduce themselves. But I will share. So we have Dr. Ritesh Ramdhani, who's in MDS at Northwell. And we have Dr. Jorge Patino, who is a fellow at the University of Cincinnati. And we have Melissa Livingston, who is a person with Parkinson's and has pretty much her PhD in Parkinson's at this point, just from her lived experience. So see, we just got a bunch of doctors on our panel, but I am going to let them introduce themselves a little bit. So I'm going to offer this question to each of you. So thank you for joining us. So we'll start with Mel, and then Ritesh or Jorge. Introduce who you are and how have you been engaged with PMD Alliance? And in your opinion, what makes PMD Alliance different than other organizations you've worked with?
This is a good question because my answer is it's a little bit different, I guess, than everybody else's answer. So I've been on social media for about 6 years since I got diagnosed. I used it as an online journal to kind of just write my feelings down about Parkinson's and thinking that no one would ever read it because like TLDR is a thing. And apparently it's not always a thing. And people started reading and Parkinson's looks like me kind of took off. Is it the hashtag that I used to kind of just represent my experience. Thank you for telling everybody what TLDR is because I always have to run the acronym through my head. So PMD Alliance merged with YOPN, and Anna had asked me to work with her other podcast hosts on the Living Well Starts Here podcast, which is now the Parkinson's Looks Like Me podcast. And I was a little bit put out that PMD had merged with YOPN. Like I just didn't see it. I didn't see the merger. I didn't see the benefits. I didn't feel like it was a fit. But I didn't really know anything more than just the one experience that I had, which wasn't a bad experience at all. It was a great experience, but it just didn't I just wasn't wowed. But again, that day my children were also very annoying, so they were not feeling it. So I kind of was a bit grumpy about that, had a little bit of chip on my shoulder. And as I started to work with people in PMD and everything, I got to get to know everyone as people and within their positions, I realized that this is like just a great big heart. Like everyone has such a huge heart. And for the amount of accomplishment and achievement that this organization has had in this short period of time that I've known them is remarkable considering the small amount of staff that there is. Like everyone is so committed and everyone is so willing to drive forward the things that we need as people with Parkinson's that like I couldn't possibly ask for. And I think it's just wonderful. Like everyone just wears their heart on their sleeve and everyone is so positive and fun and funny and it's really.
And that chip is kind of falling off your shoulder, right?
That chip is like obliterated. There's no chip. What chip? I don't have a chip. Like I'm almost embarrassed to say it now because I was like, at first I was like, oh, really, really, and then I learned, and Esther had said to me, just hang in because I feel like this is going to be good. She's a bit more future sighted than I am, and less stubborn. So I said, okay, I'll follow you. And here we are. Like it's been a wonderful, wonderful experience. I'm so, so, so proud of that. All everyone at this organization. As I continue to meet people, like there's not a single person who hasn't impressed me. Just as an empathetic human being and just an all around good person. So, and I don't say this kind of stuff easily. So,
Thanks, Mel. Jorge, do you want to introduce yourself and same questions for you?
Yes, so thanks for having me here. I'm very happy to see familiar faces, but also meet others that I haven't seen yet. I'm Jorge Patino. I'm a second-year movement fellow at the University of Cincinnati. I'm originally from Colombia, and I did my residency training in Houston. My first contact with PMD Alliance was through ATMRD. So I was trying to find for other opportunities to improve my knowledge in movement disorders and trying to like understand if that was the field that I was going to be committed for the rest of my life. And I think that's the best decision so far. And when I attended TMRD and I signed up, they were offering scholarships, which for residents, that was very important because sometimes funding for attending other educational events it's very limited.
And can I just add in there for people who are not familiar with ATMRD, that is our therapeutics conference. It is a healthcare provider conference. And we will talk a little bit more about that, but just to lots of acronyms in our world. So
And connected to that, they had a program that's called Campfire. So you are allowed to apply to that as a resident or as a fellow, which is a 1 year or longer mentorship program that is tailored to your, like pretty much your stage of training. So if you're a resident, they take into account and pair you to a mentor who is able to guide you through that residency stage. And then if you're a fellow, kind of like the transition to trying to keep track of your goals and also what's coming next. And I've been in that program. This is my second year, and it was a fantastic experience. Through ATMRD or in Campfire, I was able to like meet other people, which was fascinating, and we can talk more about that. But it's just understanding that it wasn't just me who was looking for more opportunities to learn about movement and what is there to be done, not only from a clinical standpoint but also from a research standpoint, and like understand all the wonderful therapies that are coming, that are under development, the trials, how to get involved with that. So we kind of built a very interesting community. We have like 17 WhatsApp groups in which we share just different activities or interests or any other initiatives, and there is always something happening. So wherever we go, there is someone who is part of this community, and having that support is very important. The mentorship that I've received so far has allowed me to really boost my career in a way that probably wouldn't have happened if I didn't find this community. And I'm just really happy to be able to contribute and give back because we've received so much, and there comes a time that we have to also find ways for us to contribute and give back, and just making sure that these kinds of programs and initiatives continue to exist, because the way it impacted me, I wanted to impact others, and this will just help everyone else, not only physicians, but our main hope and interest, which is our patients in the community that we serve.
thank you, Jorge. And as he mentioned a few things, mentioned obviously, as I mentioned, our advanced therapeutics ATMRD, but also our Campfire program. And he did mention that it is a mentorship program, and we will for early career movement disorder specialists, folks who know they want to go into movement disorders, who obviously treat Parkinson's and obviously other movement disorders. So we will go into more about that in a little bit, but just want to make sure you all know that we'll introduce you more to some of those programs, because this may be the first time you're hearing about it. So Ritesh, why don't you introduce yourself and talk a little bit about how you've been engaged with us? And I know you've worked with many organizations over your career as an MDS, and would be interested to hear how in your opinion, what makes PMD Alliance different?
Great. Well, thank you, Rebecca. And I'd like to thank the entire PMD Alliance for inviting me for such a wonderful webinar, and the opportunity to meet and talk with everyone here. I'm a movement disorders neurologist for about 15 years. I work in New York for Northwell Health, which is the largest health system in the New York region. I serve as the director of the Deep Brain Stimulation Program, as well as the regional director for Parkinson's and movement disorders. I was introduced to the PMD Alliance by the late, great Carol Walton, who was a maven in Parkinson's advocacy, was the CEO of the Parkinson's Alliance, and she's the one that really um, taught me what advocacy really looked like. And she's the one that introduced me to this great organization. And I've served in the capacity as a mentor for wonderful burgeoning movement disorders neurologists like Jorge, as well as attend the ATMRD conference, which is a wonderful conference that really brings together all stakeholders involved in all aspects of Parkinson's, patients, industry, researchers, providers, nurse practitioners, allied healthcare. This is the only organization that I know that in this space that is really working on today's problems to enhance quality of life for Parkinson's patients. And the work that they're doing, the commitment they have is next to none. And so it's really been an honor to be a part of this organization and continue to work with them to offer up solutions and to promote new outside the box thinking and how to address today's issues for Parkinson's patients. So I'm looking forward for further in this discussion with the group.
Thank you, Ritesh. So to give everybody a little bit more context, why did we choose these three individuals? And Aaron really touched on it as he was introducing. So I'm sure many of you probably know about a lot of the work that we do directly with the community. Maybe you've attended one of our online programs, or you've gone to a program in your community. Maybe you're a support group leader, or know people who've attended our support group programs, or you're a member of YOPN. But some of the work that we've been doing over the last couple of years, as Aaron said, specifically related to access. And access is a big word. So what do I mean by that? Currently in our system, there are approximately 660 movement disorder specialists. This is for all movement. This is in the US also, I should clarify that. There's less than 10 in rural areas, and there's about over 40 million people with a movement disorder, not just Parkinson's, but a movement disorder across the US. And we'll talk about some of this later, but one of the challenges is that the system doesn't work, that doctors, even if a doctor was in clinic every single day, that's 60,000 plus patients that they have to see over a year. Like, the math doesn't math. So when you see the 9% might see a specialist, and then a much larger percent sees a general neurologist. PMD Alliance has been really working and getting to know our movement disorder specialists and the fellows and talking to the community. And we're a really nice intersection of all three, because we're not just in one silo or another. And so we're really learning where some of the challenges were for the movement disorder specialists, specifically because we are also seeing that number potentially start going down for a number of reasons. And so we started asking ourselves several years ago, after we launched AMDAP, which is the Association for Movement Disorder Advanced Practice Providers, which is now their own organization that we're very proud of. We were like, what else is missing? Like, where are these gaps? There's more gaps in the system. And one of those things is there's just not enough specialists. And we started asking why. Why is there not enough specialists? And why are there not enough? Like, you go to a general neurologist and I hear this all the time. You get told, oh, you don't look like you have Parkinson's, or they don't listen to you, or they're only focused on certain symptoms, but they don't ask about others. And you're left for 6 months to 3 years, or however long it takes for you to get in, or you're just not getting the care that you need. And so we started a couple of programs like our Advanced Therapeutics conference and Campfire as a place to start as we move forward towards trying to fill that gap of care, and not just in the communities that currently have movement disorder specialists, but especially in rural communities. So our conversation with the three folks I have here today you can't just have the conversation with just physicians or just patients, right? You need, or people with a lived experience. We really need everybody at the table talking about that experience, because that's where we start to see overlap. So My first question, as we talk about access, to really set the stage, is Mel. So, Mel, I want to start with you. As you mentioned, you and I have worked together very closely on the podcast and in other ways. And one of the things that that really stuck with me, a story that stuck with me, was about how when you moved from Pennsylvania to Texas, that there was potentially going to be a year and a half wait to even get in to see someone.
Yeah.
And I started thinking about all of the things like what's going to happen to your medication and et cetera, et cetera. So can you talk a little bit about that experience and what did that gap actually feel like to you? And obviously it got resolved eventually and we can talk about that, but what did that gap feel like for you day to day when you made that move?
It was always there in the back of my mind. And I actually didn't know that I was going to have a gap of a year and a half. I thought there would be some gap, but I didn't think it was going to be anywhere near that. And in Texas, I have not fact checked this, but what they told me was that they can take a certain number of Medicare patients, and then they don't have to take more patients. So because I am a Medicare patient, I got bumped. I My first appointment that I made, I waited 3 months to get in. And one day before my appointment, they called me and they said, "We're sorry, we don't accept your insurance." So I said, "But you do though, because I called and it's been 3 months, blah, blah, blah." And they said, "Not anymore." And that happened to me twice. So the second time I was beside myself because my health was rolling downhill. I had taken a huge step and I had moved across the country. It was physically taxing to a body that was already in distress, and it just became this tumbleweed or this snowball, I guess you could say, that just was picking up momentum and it was just getting bigger and bigger. So that by the time I was seen, my first appointment, I was like, DBS and drugs, because that's what I need. Um, but it took me a very long time to get an appointment, and I had to call in a favor.
Yeah, which happens sometimes, right? Like
Yeah,
you had a friend who happened to have a connection, and that connection, I know I've personally, if I know somebody and they're able to get somebody in, I've done that for
yeah,
them before. And I think that happens across the community. I'm sure
of
if you're
course.
listening to this, chances are you have experienced that or know somebody's experienced that. It's not specific to Parkinson's. This happens across the board. So my
Hmm.
question, with that story is going to actually go back to either Ritesh or Jorge. Either one of you can answer this. But in your opinion, given some of even what Mel has shared, and I know there's a sense of the landscape, right? I've heard anywhere from 6 months to 3 years wait times, depending. Some places completely stop taking patients. So in your opinion, what causes this gap in wait times? Like why do we experience those?
Well, um, it's a complicated situation with multiple factors, but um, major drivers of this, and we've seen this over the last probably decade and a half, that the access to care in the wealthiest country in the world that spends the most per GDP per capita per patient has serious access problems. And uh, when it comes to chronic diseases and that are now more treatable and patients are living longer with better quality of life, um, that should not be happening. Some of this comes back down to the way health insurances are structured. We have a shortage of neurologists, movement disorders neurologists in the country, various regions of the country. That deficit is significant. I think only 6 or 7 states probably meet their level of neurology care that they need in terms of specialists in the state. Um, and then you have fellowships. We have an abundance of fellowships in the field. However, only about 70-75% of the fellowships go filled. And so we have an enthusiasm gap. And some of that enthusiasm gap and why young doctors or residents may not be going into the field is driven a lot by work-life balance, socioeconomic issues, et cetera. And so I think the way healthcare has been structured of late has led to this problem. And we could keep adding neurologists. That's only one part of the solution. What happens is because Parkinson's requires continuous follow-up care, the more neurologists that we add, they will reach a saturation level. So we have to offer up solutions outside of just increasing the number of neurologists. That's one part of the solution. But we need to be able to figure out new innovative ways to take care of Parkinson's patient on a continuous basis so that you're increasing the bandwidth for which movement disorders neurologists could see more patients, oversee teams of providers, including nurse practitioners, in caring for patients with Parkinson's without seeing a lapse in quality. And those are some of the biggest challenges we're facing. And the solutions for this is going to come from this kind of advocacy and these kinds of discussions. There is no one solution for fixing the major access problem that Mel and many others, I'm assuming on this call, have dealt with. This is an ongoing issue for us, even in New York, which has an abundance of movement disorders neurologists. We've seen our wait times go up as well. And that's because we're hitting saturation levels. And you bring a new doctor in, they will reach a saturation level within a number of years as well. And so I think this is where the Alliance and the kind of work that has been doing to try to spread or to increase or enhance the training of general neurologists, fellows, nurses to take care of Parkinson's patients is so important.
And
because if we had more neurologists taking care of these patients, the need for that 10% of movement disorders neurologists drops so that they can handle the complex conditions that come as the disease progresses.
yeah, and this is something, so I talk to a lot of doctors, and I have over the last 5 years, from fellows who are actually where I first started learning about what the education looks like of somebody who goes into neurology or goes into movement, and it always ebbs and flows because in neurology you have multiple subspecialties, correct? And one of the things that I've heard, and I know this is different everywhere, and Ritesh, Jorge, tell me, I know you've heard some of these things as well, because I did see a question in the chat that asked, what is a driving factor, or what is the driving factor? There's multiple driving factors why there's a low number of MDSs in the neurology field. We wouldn't have enough time, and the lot of time. Aaron will definitely have the hook on me before, taking me off stage before I finish that conversation. But one of the things that I've heard, I was very surprised early on when I would talk to fellows who would talk about their neurology residency, and they would say, I'm so excited. I'm actually quoting a conversation that I had at one time with some fellows. I'm so excited. I got an extra week of movement in my neurology residency. And I was like, oh, that's great. Like, how much time did you have? I assumed they had a couple of months at least, something. She's like, oh, no, I only had one other week. And that's a lot. Like, and I started asking and that was because I was asking the other fellows, and they were saying in a lot of their institutions, they're lucky if they get maybe 3 half days, maybe less, maybe a week, in their entire 4 years of residency that is required, right? Like, you can choose movement, but if you're not exposed to movement early on, which if you think about our healthcare system, right, they're residents are very inexpensive labor. I'm going to say it. They're very inexpensive labor, and we need them inpatient, right? So if you're only getting that, you're not getting any real exposure to movement disorders at all, let alone Parkinson's. Tell me if that has been your experience, or if you have heard those things. I know, Jorge, yours was a little different being at UT Houston because they have a pretty fantastic program. But that's what I've heard in terms of like, so when you go to a general neurologist, chances are maybe they've only had a few days of movement training in their entire residency, and everything else is they're potentially learning on the job. So feel free to fact check me, tell me if that's what you're seeing. But Jorge, do you want to answer that? And then maybe Ritesh?
Yeah, I think that's very accurate. I was just gonna say that after high school, it takes about 12 years to make a neurologist, 12 years of training, and then the plus 1 or 2 more years if you want to go into movement disorders. And just part of the curricular expectations really do not include neurology as a mandatory clerkship, just to start with in med school in many different institutions. So that's the first barrier, is trying to make medical students get in contact with neurological disorders to start with. Then when people go to residency, we face the same issue, in which some programs in neurology do not have a mandatory movement disorders rotation, and it just becomes something elective, that which means you have to be already motivated on your own to go into that field, because otherwise you're not going to get trained to see these patients, learn how to diagnose them and treat them. So that's a challenge. There is right now the American Academy of Neurology is advocating to change that, but is when you go to train in movement or any other subspecialty in neurology, that's what we call a fellowship, and you have to apply. And the applications for other kinds of fellowships like stroke or epilepsy, neurophysiology, those happen way earlier than the ones for movement disorders. Movement disorders and neurocritical care are the ones that happen at the end, during the second half of the third year of residency, while the others are happening during the second year. So there is a huge pressure on residents to apply for a fellowship different than movement, because they get more exposure to that in their first years of residency.
And then they're asked right away to apply for a fellowship.
Exactly. Even and they haven't even had an experience in movement. They don't know if they would like it at all. So by the time the application for movement opens, they're already committed to do something different, like stroke or epilepsy, things like that. So that is a significant barrier. And we've had people who changed their minds, and they're like, oh my God, I really liked movement disorders, and end up doing a dual fellowship. Like, I'm going to do 1 year of this, and then I'm going to do movement disorders. But again, all of these things together are not letting us train more movement disorders physicians.
Absolutely.
Sorry,
No,
just
please.
something quickly, which is that even though we strive to make more neurologists and movement disorder specialists, it is often that it's not the neurologists who see our patients first. It's other healthcare providers in the community, like family medicine physicians or internal medicine doctors. Sometimes that's the first contact our patient have with any kind of medicine to treat their neurological complaints. And that's a whole different issue also, that they don't get any training at all, mostly nothing. When I was training in UT Houston, we had our internal medicine residents rotating with us for 1 week, and that's all they did in their whole 3 years of training. So that's another huge challenge, to get them to see someone and get treatment in a timely manner.
And so and thank you for sharing all of that, Jorge. And, there's definitely a test afterwards for you all to remember all of those issues and challenges. My team will tell you that it's taken a long time to even like wrap our heads around it. And we're still wrapping our heads around this system that feels foreign sometimes. But one of the things I know, so Jorge, you had talked about attending ATMRD as a resident. And one of the things that PMD Alliance has been really starting to focus on is actually providing scholarships to individuals in their first year of their neurology residency. So for Jorge and Ritesh, PGY too, but I know that doesn't mean much to most other people. But that first year when they're officially starting their neurology education as a resident, and Jorge and Ritesh, when it comes to and try in a way to expose them to movement, even if they don't go into movement disorders, which we would love more specialists, of course. We know, and I would say about half of the residents that come to ATMRD, and this is all anecdotal, but they say that they might be general neurologists. And so, they're getting 4.5 days of all movement, which, is even more than they're potentially getting at their residency. So Jorge or Ritesh, or maybe this one is for Ritesh, could you talk about, when you're looking at, as a director of a movement disorders clinic and looking at the future pipeline of neurology and movement disorder specialists, how does doing something like that impact, in your opinion, the potential pipeline, or how does this impact patients moving forward, do you think?
Yeah, no, I think it certainly can have a significant impact. If residents coming out of training feel somewhat comfortable in diagnosing Parkinson's disease, working it up initially and starting treatment, that's enormous. That's how it used to be. What has happened in medicine is that we've gotten over specialized. And some of that is because medicine has evolved exponentially in the last several decades. We've had major discoveries, advancements in therapeutics. Looking just in Parkinson's, what we're able to do now. There are things that we are doing now in the way we treat it, that I was not trained on as a fellow over a little bit over a decade ago. So I think that the hyper specialization that has happened is a result of the kind of discovery, innovation, and advancement in neurological care that we have seen. And so therefore, saying that we can rely solely on general neurologists to take care of Parkinson's patients long term is a very tall task and probably not achievable. But if you can have general neurology feel comfortable once again in diagnosing and managing Parkinson's, at least at the early stages, that then starts to open up the bottleneck, so that the movement specialists, as we are working, as the Alliance is working on it, to increase the percentage of MDSs out there, moving that number from 9%, hopefully, to somewhere north of 20-30% of years to come. They could then take on the patients as they're requiring more advanced therapies, whether it's the pumps, whether it's DBS, whether it's the next potential disease-modifying agent that we will ultimately land, stem cells or gene therapies. The educating general neurology needs to start at the residency level. Jorge is absolutely right about that. But again, that's going to have to come from structural changes within residency programs and the ACGME, that sort of puts the guidelines around resident training, because there are many residents that don't even the faculty that are training them, they don't even have a movement disorders neurologist on the faculty. So offering these sort of scholarships so that they can get that exposure, get that experience, and get that mentorship from a movement specialist as part to complement their training, I think can have enormous value for them.
Thank you. So want to go into a little bit more about our campfire program, because Jorge, that's obviously how you and I met and engaged. And you said earlier when you were introducing yourself that, coming to ATMRD as a resident really helped you determine that, yes, I want to go maybe into movement. And when we did, so every year, it's still a bit of a pilot program for us, our mentorship program. But one of the things that we do on purpose is when we match a movement disorder specialist with one of the fellows or residents together, it's not just about what they're interested in, but we also have the requirement that they cannot be a physician from an institution that they attended as a resident, or if they are a resident, or a place that if they're going to a different place for fellowship or that is in their fellowship. We want them outside of their system. And Jorge, one of the things you had said when we talked to you at the end of this last cohort year is, and I told you this really touched me because I didn't expect to hear this, but you had said that being in Campfire truly changed your life. And I wanted to hear from you with some of that in mind. Can you just talk very briefly about what you meant by that? And you had said also, I think, like that you think it's going to change the lives of many people, the simple mentorship program.
Yeah, it really, in many different ways, being in Campfire and getting into PMD Alliance has changed my career significantly. The first one with a mentorship program, I got matched with a my mentor, who's Claudia Testa. If you're watching, hi. But that the most important part of that is that this was a connection that I didn't think was possible, but it was facilitated through the program. I'm like, this is such an important, busy person. Why do they dedicate one Monday every 3 months to meet with me? And it was just chatting about life. It's like, how are you doing? What are you doing in your career, your fellowship? What can we do to make this better? And through that collaboration, we got to create so many ideas, not only for my professional growth, but also, I mean, I'm interested in research, and we did some collaborations remotely. And she's in North Carolina, I'm in Cincinnati. We were able to work with that. And I think that that opportunity really opened the doors to become more involved with in the movement disorders field, and get more visibility and create more projects and learn how to be a mentor. And I think that that was really significant. Another part of, again, of this whole interaction is when I applied for residency, part of my personal statement said, I used the analogy of the half-empty glass. And I feel like this is something that what impacts the most when you belong to these programs is seeing that neurology is not that half-empty glass anymore. Is like there's so much to be done, and there's so many new therapies and things that we can use. And that's probably something that we should emphasize to tell the others, look, there's so much to be done and so much research going on that if you come to this field, we're going to be able to help a lot of people. The other thing from this interaction that I was going to highlight, I mean, that has really changed the way I practice medicine nowadays, is the way Campfire and ATMRD and PMD highlight the importance of not only physicians, but other healthcare providers. And that synergy with APPs, it's something that I see in my fellowship program and the way our clinic works. And I see that that's an incredible advantage of a healthcare system, which is having these very highly prepared, skilled, and educated healthcare professionals who are not MDs necessarily. They have their focus, their careers, and they're very good at what they do, and they can help us take care of our patients continuously. So I think that seeing all these three things really shaped my career in a way of like, that's what I want to do in the future. I want to make sure that all these resources are utilized the way they're supposed to, because this is really helping us decrease the shortage of providers that can take care of our patients, and also improve the prospects in terms of career for future trainees with these mentorship programs, in terms of opening doors, creating more networks, and connecting them with other people who are willing to help.
Thank you so much, Jorge, for sharing all that. And I'm getting like the hey, Rebecca, you only, so I'm like, okay, going through some of my questions. But one of the things, so part of why we even started something like Campfire or our HCP conference, and why we're talking about this today, is that our goal, where our vision is that we want to build this pipeline of specialists, but also build a pipeline of educated neurologists and APPs and others. Like, we're talking not just tomorrow, but down the line, because our doctors are the ones who are also doing the research. So if we're looking for cures or understanding more about Parkinson's, etc., we need more physicians, because a lot of them do research and are part of that research. But also because of this gap in care, because of situations like what Mel had shared at the very beginning of this, that I think many of you have experienced. And it's great that we have all of these therapies, etc. But if you don't have physicians who understand them, when you go to your doctor's office, I mean, how do you, they might not even want to prescribe something that could support you. Who's to, more specialists, more neurologists that understand, more researchers, means that we may have a therapy that is disease modifying at some point, right? But when we don't have enough people, so PMD Alliance's goal, long-term vision, is that we want to bring education early on in residency, eventually into the medical students, getting them interested in neurology. But also, and this is why, again, we have this grouping of individuals, is the experience, the lived experience, and how important that is. And I don't know how many times people go into a doctor's office and they're like, the things I'm talking about, my doctor doesn't seem to care about. And the things that the doctor cares about doesn't seem to be what the patient cares about. And so really trying to emphasize and create empathy across the board so that individuals who are going into their doctor know how to have the conversation with their doctor, but on the other side, the doctor really has some understanding and compassion for them as well. And I think that that's something and that we include in all of our ATMRD content, but then also that is a big part of what we're trying to accomplish, even in building community amongst our next generation. So this is where we're starting. The reality is we will continue to do this work. We could do it a whole lot faster with the community helping supporting this work. Just the more support that we have, we know that most people don't have the opportunity to, everybody's on very strict incomes and things like that. But we have options for how people can fundraise for us and how they can, and this money, like we're 14 and a half staff members, and we're already doing something and trying to forge a way forward that's actually not being done anywhere else. Ritesh and I were just talking about that yesterday, right? Like, in actually trying to make a change in the system. And it's going to take some time, but again, it'll take a lot less time if the community supports us and talks about it and, comes around us and says, this is important to us. We want to make sure that we're investing in all of these things. So and Aaron will talk a little bit about this in a few minutes, but we hope that you will join us in that, so that we can expand programs not just at this mentorship level, but we'd love one day to go to regional institutions that don't have a movement disorder clinic or doctor, and to be exposing those residents, those students to movement disorders, to Parkinson's, so that they are interested, so that they are taking on those electives and making different decisions as they go out into the world. So I want to ask the last question, and this is I'm going to start this one with Mel, just like we started the whole program. And Mel, you know a lot of the different things we've done. Obviously, we've talked about this work as well, just one-on-one. But if the work that we've started to do, in your opinion, if we didn't continue that work, what do you think? What do you feel like would be lost? Maybe it's not even just about access, but like everything we do, the work we do with YOPN, the podcast, etc. What would be lost if we weren't able to continue those things?
It's visibility. I had a conversation with my MDS recently, which was fascinating, that he's recently started following people on social media, people with Parkinson's on social media. And I tried to get him to do this a couple of years ago, but he wasn't biting. So he's asking me, do you know this one? And do you know that one? And he was very excited, it was like the rock stars of his career. But his take was completely different than my take. His take was, I was very sad to hear. And I was like, yes, tell me. And he said that so many people were having issues getting an appointment with an MDS. He was absolutely shocked by that. He did not realize that there was such a shortage of doctors. And that surprised me too, because I didn't think that was going to be, I didn't think that was going to be his take.
And not just an MDS, like actually getting in with someone who actually understands your disease, right?
Yes, that's exactly it. So to me, it was shocking that he was feeling that way, and to him, it was shocking that that problem existed at all. And that's what I feel like would disappear, is that knowledge and that access to knowledge that's still separated by doctors and patients, because I'm fortunate that he is actually a very good listener, but some are not. So we've all had a different experience.
Thanks, Mel. All right, very speed round. I was told, maybe I'm even late for the speed round. Sorry, but Ritesh and Jorge, if the work that we've done so far with you wasn't able to continue, what do you think would be lost? Or maybe a better question, again, if it's easier to answer quickly, what do you think like if people were to invest in what we're doing at PMD Alliance, what would be had if that's an easier, maybe more positive spin to it? Like,
Jorge.
Yeah, I was just going to add that the ultimate result of not having these kind of programs is going to be that unfortunately our patients will be the most affected ones, and it would just trigger a chain of events, which means less people working in the field, less people being interested, less people being familiar with this. And at the end of the day, that I feel that it increases costs in healthcare, because we see that when patients are not addressed appropriately, they go to hospitals, they go to the ER for complications that could have been prevented. They are different kinds of workups, including imaging, laboratory studies, are sent unnecessarily for things that could have been diagnosed with a normal physical examination and history. So if you continue to educate people and continue to emphasize the importance of recognizing these syndromes and again, as Ritesh was saying, you don't need a movement specialist to start the process. You need someone who is familiar with the condition and knowing what to do with the first steps. And when things get very complicated or when you need a little bit more help, then yes, movement disorder specialist will be ready for you. But I think that's what we would lose, is the ability to help patients early when they have not accumulated disability. When disability is there, it's very hard to go back. So we just need to help people early.
thank you. And Ritesh.
Yeah, no, I completely agree with what has been said before. I think that if the PMD Alliance wasn't doing what it's doing today, it'll be a step backwards for this field. This is raising the volume at local, regional, and federal levels in order to get exact change. Parkinson's care needs to be changed both from at a local level and at a federal level. The way resident training is done needs to change. The way healthcare is reimbursing for chronic care in Parkinson's needs to change. The research funding is growing. But we need the kind of advocacy that's been on the research end to be on the clinical care end. This is where I think PMD Alliance needs to continue to lean into this. We have to figure out a way to come up with solutions, real viable solutions in caring for people long term. We now have a technological boom going on worldwide. We have artificial intelligence now. How that plays into this is it's certainly going to play into this. And so you want an advocacy platform that is able to say and to really be the voice for patients and bring patients and providers together in unity to say these are the solutions we need to be looking at. These and being able to go to hospital administration and Congress people, not just for research. We have to treat quality of care today. This is what's going to keep Parkinson's patients doing well long term and cut the costs that Jorge alluded to in his previous statements. So yeah, this is important work, and I applaud the Alliance for taking this on.
Thank you so much. All right. Well, we have to end this part of the conversation here. I'm going to kick it back to Aaron because we do have somebody else who's going to talk about how we are supporting the clinical system in a little bit of a different way that you might not know about. So, Aaron?
I've been trying to give you the virtual hook for the last 10 minutes, but that's all right. That was a fantastic conversation.
Sorry. We get very excited.
So as Rebecca alluded to, access to care doesn't stop at the doctor's office. As those of us age and need to begin to change, sometimes long-term care really starts to become a consideration. Making sure that those communities are trained on how to support residents with Parkinson's is something we heard loud and clear from the get in one of our founding programs. Certified Parkinson's Disease Care, what some of you may have heard us refer to as CPDC, has certified long-term care communities across 19 states, training over 10,000 staff members on proper support for residents with Parkinson's. These communities all report significant reductions in falls, reductions in hospital admissions, and have properly trained staff who understand the importance of medication timing. Joining us today is a long-term friend and advocate for our CPDC program, Melanie Seamans. Melanie is the Vice President of Operations for Ciel Senior Living, certified care partner who operates communities nationwide. She comes with a distinguished career in the senior living space. She was super quick to volunteer her time today to share some of her experiences in working with us and what that's meant for the communities of residents in her care. And I can't tell her how thankful I am that she took the time to be with us today. With that, Melanie, it's all yours.
Well, thank you, Aaron. It's my pleasure. As he said, I am the Vice President of Operations for Ciel Senior Living, and we operate in about 11 states right now. And about 2 years ago, we made a strategic decision to partner with the Parkinson's Movement Disorder Alliance group. I can't say enough about them because Calissa is just wonderful. I know her boss is somewhere on this call, but she's a senior manager of certified care, and she has been a wonderful partner. We decided we saw a growing focus in our assisted living and memory care communities of people coming to us with Parkinson's. And as we specialized in Alzheimer's for so many years, we decided that it was the forefront of what's come that we should become Parkinson's certified. So it started with the executive staff of our organization and buying into that. And then we took it to the communities and we train the communities. We have champions at each community, and then we train down to including the caregiver level, the housekeeping level, the activities level. Everybody goes through training, both online and live and in person, so that our goal is to ultimately increase the experience for a resident that comes in that has Parkinson's or their family members, and the quality of life for our residents and families. We have done support groups. We have partnered with our in-house therapy providers to do exercise programs that we invite the public to, specializing in Parkinson's focused exercise. That has been a big win all the way around for everybody. But I just think the branding of us as a joint partner has been wonderful on both sides. We just feel it's a wonderful organization. I can't say enough about it. Everybody in our community has someone they know, a family member, a resident they've cared for, whatever, that has had Parkinson's. I can't also stress enough the focus we do on medication management because of the knowledge we have and the importance of the timeliness of those medications for residents that have Parkinson's. We also get specific training from PMD Alliance that we share with our clinical staff, and we get newsletters every month that we share with them. So every single person in our communities is involved. We know the differences in how to care for a Parkinson's resident and provide the support to that family member as well. I can't say enough how wonderful it's been, and we're proud to be all of our communities in the states that we have are either certified or in progress to be certified. And I believe we're the only senior living organization that has made that commitment. So I just wanted to say that. I don't know if there's anything else you want me to touch on. Aaron.
No, I can't tell you how much we appreciate your continued support and, most importantly, your support of your residents and understanding the various movement disorders that they may come to you with, and really working to make sure that that you and your communities provide the level of service that they need in order to maintain a great time while they are there.
Right. So we are there for you whenever you need us. It's scary for some residents and families to go to assisted living and memory care, but I always tell people that you should be proactive and look into it sooner than later, because otherwise an acute situation puts you in a situation where you don't have a lot of research or time. So I encourage everybody, if they're looking for an assisted living or memory care, to please look ahead of time and prepare. But there are many resources that cover your stay in assisted living and memory care also, and that you look for the communities that specialize in what you're looking for. So thank you.
Fantastic. Thank you so much, Melanie. I appreciate the time today. I do know that we are just at the 1 hour mark, so I do want to be respectful of everybody's time. That said, just a quick recap. Today is really about shining the light on that real heavy lifting underway that really has been going on behind the scenes. That being the case, it's still going to enact the most change for this community. I want to take a moment to highlight the fact that all of this work, everything we've talked about today, all of the public facing stuff we do, our online programming, our in-person programming, our support group leader training, all of this is done by a team of just 14 people. And it's done by an organization that has a budget that I don't even think is large enough to qualify as a shoestring. It's a fraction. Frankly, it's probably a rounding error of the budgets of some of the larger organizations in the space. So I am going to put on my director of development hat here at the end. I'm sorry, I wouldn't be doing my job if I didn't do it. We cannot do this work without your support. Most importantly, we can't scale up the work to meet the growing demand for access to care without your support. We've been here an hour. That means 10 new people were diagnosed with Parkinson's while we were together. That's 10 new people looking for care. That's 10 families looking for support. We continue to show up every morning to provide that support and increase that access to care for all of these. But we need to continue to grow as the need continues to grow at this pace. I also understand that money's kind of tight these days. Someone who's working for a small nonprofit, I totally get it. Then you layer on medications and doctor copays. I understand that money can be tight. If you're unable to donate, we have peer-to-peer. Start a fundraiser. You can host a game night or a poker tournament. You can walk in a 5K, do a sip and shop at a local store. All of that is supported through our self-service peer-to-peer portal that's in the chat right now. For those of you joining us on YouTube, the links to both our giving and our peer-to-peer pages will be in the description below the video here. Again, as we tie this up, if there are any questions that I can answer or that weren't answered in the chat today or that come up later on, please email me directly. You can reach me at Aaron, AARON, at PMDAlliance.org. I'd like to thank everyone for joining us today. I'd like to thank our panelists. I'd like to thank Melanie. And I'd like to thank all of you for your continued support and partnership with PMD Alliance. We work each and every day to make the world better for movement disorders community. We ask you to please join us in this work. Thank you and have a great rest of your day.